Cashews are a type of nut with a soft consistency and sweet flavor. They are native to South America, specifically Brazil, and were introduced by colonists to Africa and India. These regions are the largest producers of cashews today. Cashews are sold both raw or roasted, and salted or unsalted. Cashews have recently been used to make dairy alternatives, such as cashew milk, cashew-based cheese and cashew-based cream sauces and sour cream. Cashews also contain vitamins C and B, including 7 micrograms (mg) of DFE folate. A 1-ounce serving of cashews is about 18 whole cashews. Cashews are high in monounsaturated and polyunsaturated fats and a good source of protein. Consuming a high proportion of plant-based foods appears to reduce the risk of many lifestyle-related health conditions. The monounsaturated and polyunsaturated fatty acids found in cashews can help decrease LDL cholesterol and triglyceride levels. This reduces the risk of cardiovascular disease, stroke, and heart attack. A study published in the British Journal of Nutrition showed that the risk of coronary heart disease may be 37% lower in people who consume nuts more than 4 times per week compared with people who never or seldom consume nuts. The U.S. Food and Drug Administration, FDA, have approved a health claim for food labels that eating 1.5 ounces per day of most nuts as part of a diet low in saturated fat and cholesterol may reduce the risk of heart disease. Cashews are a good source of magnesium, which plays an important role in over 300 enzymatic reactions within the body. These include the metabolism of food and synthesis of fatty acids and proteins. Magnesium is also involved in muscle relaxation and neuromuscular transmission and activity. Magnesium deficiency, prevalent in older populations, is linked to insulin resistance, metabolic syndrome, coronary heart disease and osteoporosis. Several studies have found that a high intake of calcium without sufficient magnesium could increase the risk of arterial calcification and cardiovascular disease, as well as kidney stones. People with the highest intake of magnesium were found in the Framingham Heart Study to have a 58% lower chance of having coronary artery calcification and a 34% lower chance of abdominal artery calcification. The researchers concluded that eating nuts does not lead to a weight gain, and that it may help maintain a healthy weight. According to a study in the American Journal of Clinical Nutrition, frequent nut consumption is associated with a reduced risk of needing surgery to remove the gallbladder. In over 1 million people documented over a time span of 20 years, women who consumed more than 5 ounces of nuts a week had a significantly lower risk of cholecystectomy than women who ate less than 1 ounce of nuts each week. The magnesium in cashews is also important for bone formation as it helps with the assimilation of calcium into the bone. Manganese, another mineral in cashews, has been shown to prevent osteoporosis in combination with calcium and copper. Nuts have a high fat content, and they can become rancid. Keeping cashews in a cool, dark and dry place can improve their shelf life. If stored properly, cashews will keep for a few months at room temperature, a year in the refrigerator or 2 years in the freezer. Rancid nuts are not unsafe but have a sharp flavor most people find unpleasant.